So Dr. Therian here, and if you're watching this, likely we just talked about Pinguecula during your eye exam. So this short video is just to reinforce what we already talked about, and it's not to replace the need for an eye exam or anything along those lines. So pingueculas are these small, kind of yellowish looking bumps that are typically like 3 or 9 o'clock on the eye. Typically they're closer to the nose, but they can be over here kind of at 9 o'clock or 3 o'clock, closer to your ears. But typically they're closer to their nose, and they develop because of sun exposure, UV exposure, wind exposure, smoke, dust, any of that kind of stuff. Dryness can exacerbate and make them worse. And so those types of things are what causes these pinguecula to show up and happen. Now they're yellow because of the fact that they're kind of a lipid and protein deposits happening in that area as the tissue gets torn up by wind, dust, all those things. So as that tissue gets torn up, it has to regenerate over and over again, and those lipids and proteins just kind of get deposited in those areas. So sometimes they're flat, sometimes they're a little bit elevated. So the thing that I watch for and I look out for is, are they getting red? Is the redness there getting bothersome? Are they getting bigger? Is that elevation getting more pronounced? And then the big thing is, are they irritating you? If they're really starting to bother you, then we can do a surgery to get rid of them. But if they're not bothering you, then they don't typically bother me either. Things you can do to try to slow down their progression is wear sunglasses, because again, UV and smoke and sun and all that stuff. Plus it'll protect the eye a little bit from the smoke and the dust and the wind. Also, artificial tears to try to keep that inflammation down is really beneficial. Now remember, this video is just to help reinforce what we talked about in the exam, and it doesn't replace the need for an eye exam. But if you have any questions, we're always here to help.